Hello, my name is Kelly Mills and I'm a gerontology certified registered nurse with a current focus in long-term care. I'm also a psychiatric mental health nurse practitioner student at Eastern Kentucky University. Today, I'll be presenting my project proposal for NSC 892. The PCAT question that addresses my project proposal reads, in the older adult population, how does utilization of music therapy compared to pharmacological treatment alone affect symptoms of depression within a 4 to 12 week time frame? The 2011 strategic plan developed by the National Institute of Nursing Research included the goal to improve quality of life by managing symptoms of acute and chronic illness. Depression can qualify as both an acute and chronic illness that impacts quality of life. Population specifically affected by depression is the elderly. In adults 65 and older, 15 to 20% have experienced depression according to the Geriatric Mental Health Foundation. In this study, the subject of interest will include the older adult population related to an increased incidence of risk factors. Zari Varma, 2012, identified some risk factors to include comorbidities, low socioeconomic status, physical limitation, decreased social interaction, cognitive dysfunction, and the use of multiple medications. The purpose of this project would be to continue to build on current research that has studied the impact of music therapy on depression. The proposal will review theoretical and evidence-based framework, current supporting research, and a thorough research plan that will take place in an assisted living setting. Those who would be interested in this study would be administrators and director of nursing of long-term care and assisted living facilities. 5 studies were reviewed within this literature search. Study 1 was a randomized controlled trial performed by Mohammadi, Shahabi, and Panal. 90-minute music therapy sessions were given for a total of 10 weeks. The 21 Depression, Anxiety, and Stress Scale was used to analyze depression levels before and after music intervention. In Study 2, Chan et al. 2011 completed a randomized controlled trial that included 30-minute weekly music therapy sessions for 8 weeks. Participants were 55 and older, and the Geriatric Depression Scale was used to measure depression. In Study 3, Chan et al. 2009 similarly initiated a 30-minute weekly group therapy session. It lasted for 1 month. Participants were over the age of 60, and the Geriatric Depression Scale was also used to measure depression. Study 4 was performed by Tai, Wang, and Yang, 2015. Assisted living residents were randomly allocated to the control group or the intervention group. Intervention group received 30 minutes of music therapy 5 days a week for 4 weeks. The Geriatric Depression Scale was used to measure depression. Study 5 was performed by Chu et al. 2014 and took place in the nursing home setting. Participants were over the age of 65, and the intervention group received music therapy twice a week for 6 weeks. The Cornell Scale for Depression was used to measure depression. All 5 studies agreed that depression was reduced after music intervention was initiated. The ideal location for this project would be a 100-bed assisted living community, where residents would be voluntary participants. Inclusion criteria would require participants to be over the age of 65, have a mini-mental score greater than 20, be male or female, provide informed consent, and be living in assisted living. Those with severe hearing impairment would not be able to participate in this study. Residents would be notified of the research opportunity via flyer in the dining room. At this meeting, participants would be recruited. 20 male and 20 females will be randomly selected from those who met inclusion criteria. Half from each gender group would be randomly allocated to the control group. A week following this informational meeting, informed consent will be obtained before the first Geriatric Depression Scale would be administered. The experimental group would participate in a weekly group music therapy session lasting 30 minutes. Music genres would vary between jazz, pop, and bluegrass. The control group would get a 30-minute relaxation period in a quiet room. The study will take place over a 4-week period where each participant will complete the Geriatric Depression Scale before the intervention begins and after each session. Statistics would be reviewed on a week-by-week basis to determine any improvement in both the control and the experimental group. The Mann-Whitney U-test would be used to determine level of significance to accurately measure if there was a significant change. There are no likely physical, psychological, or social risks foreseeable. However, a breach in patient confidentiality should be considered as a risk. All participants would be assigned a randomized reference number that would be associated as an identifier on all paperwork. When analyzing results, only aggregate data would be used. This concludes my presentation. Thank you.